So now back to our practice. We are going to use the transient elastography, and I've shown you if you use the 8 kilopascal cutoff, the risk is very low for advanced fibrosis F3, F4, and of course for cirrhosis. And of course, you can follow your patients and attempt lifestyle modification and exercise. If you're above 8, you are intermediate to high risk, and then you need to decide whether you're going to take a liver biopsy or not, according to the cutoff, and screen for portal hypertension if you suspect cirrhosis. Then, of course, now we are performing a lot of liver biopsy because there are trials to propose to the patient, and that makes a difference. In case of failure, I mentioned around 7% of cases, then you might consider alternative technique according to local availability. So this is the present, and I would like to give you a very brief word during the last minutes of future perspective. This is the Champs-Élysées, what they can look like without yellow vest. So, of course, the next step are strategies for screening general populations for liver disease. And this is the proof of concept study that was performed 10 years ago by Dominique Rouleau in France. 1,000 healthy subjects above 45 years undergoing medical checkup. And you see that around 6.7% had significant fibrosis and 0.8% had cirrhosis. So there's a call for action for screening liver fibrosis in the general population and be able to diagnose cirrhosis at an early asymptomatic stage. This is a so-called liver screen project that we are running with one of the co-chair, Perry Gines. And if you look in the literature, the different study, according to the tools you're going to use, biomarker or transient elastography, and the population you're targeting, general population, will be below 1%. If you're targeting diabetics, for instance, will be above 11%. And the most common cause of liver disease apart alcohol is, of course, NAFLD. So these are my take-home messages. Choice of non-invasive tools to be used should be guided by local availability, cost, and context of use. FIB4, NAFLD fibrosis score in NAFLD, and transient elastography are the most accurate, available and validated non-invasive method for identification of patients with cirrhosis. If you're in primary health care, simple, inexpensive, and widely available serum biomarkers such as FIB4 or NFS should be used as first line for ruling out advanced fibrosis and cirrhosis. In referral center, transient elastography using the IXL probe appears to be the tool of choice for selecting patients in whom liver biopsy may be considered. RFI and 2D shear wave elastography are becoming increasingly available. Thank you for your attention.